Good morning, everyone. This is Megan Rogers with Indiana SHIP, and I am here this morning for our last April Medicare Monday. And we are going to be discussing how to make your Advantage plan work for you. Advantage plans are a very specific way of getting your Medicare coverage. So we're going to go over what Advantage plans are, when you can get them, and some things to keep in mind when you're picking your Advantage plan. If you have questions, feel free to chat those in the chat box, and I'll be monitoring those from time to time. And then if you watch this as a recording, you are able to still chat in, and Susan Spilly and I monitor those for questions, and we will respond as soon as possible. You can also send us a Facebook message, or you can call us at our call center, 1-800-452-4800. All right. So what is an Advantage plan? These are private insurance companies, managed care entities that are approved by Medicare, Centers for Medicare and Medicaid Services, to provide your Part A and your Part B benefits. Just as a refresher, Part A covers your inpatient hospital, hospice, or nursing home for rehab. And Part B covers your outpatient. So outpatient surgery, doctors, tests, durable medical equipment. Now you are still on Medicare. These plans are approved by Centers for Medicare and Medicaid Services. You generally get Part D drug coverage included as well. You have to be careful because some Advantage plans do not have the prescription drug coverage included. And you want to make sure that you do have that included, even if you don't take any medications. They generally come with extra benefits: dental, hearing, vision, gym memberships, over-the-counter cards for um, supplements, vitamins, Tylenol, incontinency supplies, those types of things. There are even some that do provide assistance for rent and utilities. They do come with different names. So you may have heard Part C, Medicare health plans, Medicare replacement plans. And then they're based on where you live. So you put in your zip code when you enroll. If you move, you need to make sure that you are contacting them to see if they cover you in the new zip code. So how do these Advantage plans work? CMS, Centers for Medicare and Medicaid Services, gives money to the private insurance company every month to manage your Medicare benefits. They have to cover the same exact original Medicare coverage services. You still have the same rights and protections as a Medicare beneficiary. You get those extra benefits as well. Depending on what plan you pick, you have to use in-network doctors and hospitals, and we'll expand on that in a minute. And then they all have different copays and deductibles. So original Medicare, for example, we know that Part B, you pay 20% for anything covered by Part B. That may not be the same for your Advantage plan. Your Advantage plan can determine what your copay amounts will be for each service, and each Advantage plan is different. You still pay your Part B premium. Now, there are a few plans in Indiana that have a give back benefit where they will pay some of your Part B premium. But keep in mind, at least from what I've seen in my area, northern Indiana, those that do pay for part of your Part B have a much higher max out of pocket. So it may not be worth it in the long run. There are some Advantage plans that have a small premium, usually nothing over $50 a month. And I would say about 98% of them have no premium. And then, like I said, there are going to be different deductibles, coinsurance, and copayments from plan to plan. You also cannot have a Medigap policy and an Advantage plan at the same time. Let me check the chat box super quick here. All right, well, while I'm looking, we'll go on. Who are Advantage plans good for? Now, keep in mind, there are probably other variables that you would want to consider, but these are the main variables that we look at when we are working with a Medicare beneficiary. You are probably going to be someone who comes into Medicare healthy, and you do not go to the doctor or hospital often. Assume that you will continue to be healthy in the future. Maybe you financially cannot afford, or you simply find limited personal value because you don't go to the doctor or the hospital often in paying higher monthly premiums that would come with a Medigap/supplement. And you're willing to stay in a smaller network of doctors and hospitals. So let's talk networks. There are two main types of Advantage plans. We have our HMO. This means in-network only. Now, they are generally going to cover your Part D prescriptions. With an HMO, you need to be assigned to a primary care doctor at all times. You will generally need to see your primary to get a referral to a specialist. And if you do go out of network, you will pay 100% of the bill. Now, our other option is a PPO. This does give you some more flexibility. You can go in network or out of network on a PPO. You're going to get your prescriptions covered. You do not have to have a primary at all times. You generally do not need to see a primary to get a referral to a specialist. And how these work is as long as the doctor you're seeing out of network is good with billing your plan, they can do that. Now, you will have to pay a little bit of a higher copay for out-of-network providers. So, for example, you're looking at a plan, it's a PPO, they may list primary care doctor in network 0, but out-of-network 20. Specialists in network 40, out of network 60. So your out of network copay for all your services would be usually higher. I've seen some where it's absolutely the same. Um, so you can still go to out of network providers. You do want to verify they're good with billing and know that your copay would be a little bit higher generally. And when you pick a PPO, your information that you receive from that plan or by looking at Medicare.gov is going to list both copays in network versus out of network. Now, when you're on an Advantage plan, you may determine that this isn't for you and you want to go back to original Medicare. So let's talk if we can do that. So there are times that you can switch back to original Medicare and get a supplement. Now, if you're someone that has health issues, then you want to be in a guaranteed issue phase because if you're not and you have health issues, you are most likely going to be denied for that supplement. So these are times that you can move back to original Medicare and if you can get guaranteed issue during that time. So if your Advantage plan is leaving Medicare, you can go back to original Medicare. You get guaranteed issue for 63 days to get a supplement. If your Advantage plan stops covering your zip code, you can go back to original Medicare, have guaranteed issue to get a supplement. If you move out of your plan service area, you can either pick a new Advantage plan, and that's the same for all three of these. You can pick a new Advantage plan, or you can go back to original Medicare, get guaranteed issue for 63 days to get a supplement. Now we have something called trial rights. These are basically two times or two situations where you can try something out and go back if you don't like it. So our first one is you're new to Medicare at 65 and you decide you're going to get an Advantage plan. Well, within the first 12 months of having that Advantage plan, if you decide you don't like the Advantage plan option, you can switch back to original Medicare and you'll have 63 days to get a Medigap with guaranteed issue. Now, our second trial right is you were with a supplement. You had a year, 5 years, 20 years, doesn't matter how long. And you decide you want to try out an Advantage plan for the first time. You can enroll in that Advantage plan, drop your Medigap. Within the first 12 months of having that Advantage plan, if you decide this is not for you, you can go back to the same Medigap that you had prior to getting on the Advantage plan, and you will have guaranteed issue, so they will re-enroll you without any issues. They won't look at your health history. All right, so let's talk enrollment periods. So when you're first new to Medicare, during your initial enrollment period, you can get an Advantage plan if you have both A and B. During the fall open enrollment period, October 15th to December 7th, you want to review your plans to make sure that they're still going to work for you for next year. Prices can change from year to year. Coverage can change from year to year. You can drop your Advantage plan, go back to original Medicare, get a drug plan. Now, you don't get guaranteed issue in this case, but if you have health issues, you'd be able to get a supplement, or if you don't have any chronic health issues, you should be able to get a supplement without any issues. You can make multiple changes. You can go from Advantage to Advantage or Advantage to Original. And then the last change made 11:59 p.m. December 7th is what will start January 1st. And then there's different special enrollment times. We'll go back to that last slide in just a minute that I skipped. So these are your special enrollment periods. So like I said, if you move out of your planned service area, you have Medicaid and Medicare. This slide I just realized is a little outdated here on this bullet point. If you have a monthly special enrollment, if you have extra help, it's not quarterly anymore, it's monthly. If your plan leaves the Medicare program, if you leave or lose employer or union coverage, if you enter, live at, or leave a nursing home, and other case-by-case situations that you can contact Medicare about. So let's go back. We also have the Medicare Advantage Plan, open enrollment. This is January 1st to March 31st every year. If you start the year in an Advantage plan, you can review your plan again and switch to a different Advantage plan, or you can go back to original Medicare, get a Part D plan. You could try to get a Medigap, but you're not going to get guaranteed issue. Your change will start the first of the following month, and you can only make one change during this time. All right, so now let's talk about some things to consider when you are looking at an Advantage plan. These are things that you want to be mindful of. Don't listen to the commercials. Um, those commercials are trying to get you to come to their plan. May not be a bad plan, it may be a good plan for you, but you want to make sure that you're comparing all the available plans in your zip code, not just contacting that one plan that you're watching the commercial for. You want to see what it really looks like compared to the other plans available to you. Be cautious of those Medicare mail advertisements. Um, those again are insurance companies wanting you to come to their plan. Again, you don't want to just respond to that one mailer. You want to look and compare that plan to all the other plans available. Don't necessarily enroll with someone who calls you out of the blue. You want to make sure you're comparing that insurance plan to other plans. Also, don't give out your Medicare number or your Social Security number over the phone if you don't know who you're talking to. And don't pick a plan just because of the extra benefits. Now, those benefits are great. However, you want to make sure that plan covers all of your medical providers, your hospital system that you prefer to go to if needed, and that it covers all of your medications. Also, that it's affordable for you. You want to make sure that you know what the premium is, what the max out of pocket is, any restrictions with coverage. Once you pick a plan for those things, then you can enjoy those extra benefits. And you also want to know what those extra benefits are and what your dollar amount is with those items, especially vision and dental. But make sure that you are verifying your medical and your medication part of those Advantage plans before you enroll. Because once you enroll, depending on what enrollment period you're using, you may not have other um, any other ability to change. So some things to consider doing if you're looking at an Advantage plan. Shop around, compare. Medicare.gov is a very user-friendly way to compare different plans in your zip code. You can put in your zip code, your medication, your doctors, your pharmacies, and you can see what plans are available to you and all the different costs. Ship counselors can also help you with that if you are not comfortable doing that yourself. Make sure all your medical providers take the plan. If you do use medical providers in different states or counties, a PPO may be a better option for you. Make sure all your medication is covered. Look at different pharmacies. That's a way to get a cost savings. I had one client that when they were reviewing the Advantage plan, he went to one pharmacy. We put in multiple pharmacies to see if there was an additional cost savings. The same plan was still the best one for him, but we were able to let him and his wife know that there was a pharmacy that was $600 cheaper for the year in the copays if they switched to that other pharmacy, and they did. And once you know, like I said, that that plan is going to take your doctors, your medications, then use those extra benefits. Make sure you know what those are and take advantage of them. All right, so that is our Advantage plan presentation for the day. Give me 1 second here. In or no? No, I'm on a presentation. Okay, 'cause I gotta. I'll be done in just a second. I'm wrapping up. Oh, I apologize for that interruption. So that's the presentation for today. Again, you can chat in the chat box. You can give us a call, 1-800-452-4800, and we are happy to assist you navigating your Medicare and determining or helping you determine if an Advantage plan is the right option for you. So that is our last slide for the month, but we do have some coming up. Let me share my screen again. All right. So next month, May 14th, we are going to talk hospice. That is at our virtual lunch and learn, so 12 p.m. Eastern on Facebook. May, we have some great Medicare Mondays and What to Know Wednesdays for you. May the 4th, we're going to talk about preventative health coverage for women. May the 13th, our What to Know Wednesday, is going to talk about mental health coverage and how Medicare covers that, because that is important, just as important as your physical care. And then we're going to wrap up the month on May 18th with end-stage renal disease Medicare. It does have some pieces in it that works differently than Medicare for age or Medicare for disability. So that's an important one to tune into if you have end-stage renal disease or you have a loved one with that diagnosis. All right. Well, thank you all for tuning in, and Susan and I will see you back here in a couple weeks. Bye, everyone.